topic. I'm excited for this. I feel fired up.
I know. Yeah. Okay, so today we are talking about a very controversial topic that we've wanted to talk about for a little while. It's that of the Kegel throne. The Kegel throne, the Emsella chair, HIFEM, what else has it been called? Many things. We are going to talk a little bit about this today, and we're going to dive in because I've had so many people ask me about this, friends, family, patients, and I think it's important that we touch on this because it's a new product that is all over the media, especially in our cases because we're always talking about it.
If you are anywhere on social media and you've ever looked up anything about birth, postpartum, peeing yourself, like you have these flashing up in your newsfeed all the freaking time.
Yeah, so we need to talk about this because it's something that I'm starting to get really fired up about.
Starting to?
Well, when you have your mom messaging you, asking you about it, I'm like, really, Mom? Have I not raised you better than this? So yes, we are going to dive into this.
I think it's important to ask because we're seeing this in this trend of like quick fixes. So is this just another quick fix or is this something that offers a long-term solution?
Right.
I think that's what we're going to get into today.
Yeah, 100%. Okay, so first of all, what the heck is it?
What is it?
So first of all, it is HIFEM for short, but it's a high intensity focused electromagnetic field. It's a big word.
A lot of jargon.
The Emsella chair that you hear about on the market is basically just a brand of that. So it's kind of like a Nike shoe, right? So you have a shoe and it's a Nike brand, Adidas brand. This is Emsella. So it's a HIFEM field, which essentially what it does, this is the scientific definition, it depolarizes membranes of peripheral motor neurons and initiates muscle contraction. And it basically does this by lowering the threshold in the nerve and it causes a contraction in the muscle. So, and it does this like quickly, like, so you're getting almost like a supramaximal contraction of the muscles. So the theory with this, and it's non-voluntary. So the theory with this is that because you're contracting so quickly and you're breaking down that threshold for contraction faster than what we can do voluntarily, what the research is showing is that it increases muscle bulk and tonality and decreases fat compositions much quicker than what we can do with standard exercise. This is HIFEM. So this is not the Emsella chair per se. This is this HIFEM technology. It's been around since the late 90s. They've been studying on animals for a long time, and it's just come out to see how it can tone, right? Emsella, this Emsella chair. So this idea that it's going through the clothing through this chair is fairly new. They've established this excitement around it because you can essentially, in essence, contract the muscles without having to do any work. And the fascination or the excitement with this Emsella chair is that because it's the pelvic floor, and normally you'd have to take off your clothes and get uncomfortable and try and figure out how to do your contraction, you can do this stuff without having to do any of that. So it's non-invasive, right? So that's where the excitement comes around this.
It's very attractive.
Yes, absolutely. And although I will agree with the fact that for some patients, they don't like to get undressed. They don't like to, and absolutely, that's totally valid. So this is a great non-invasive tool in order to do that, right? So we want to dive in today. We know what it is. How do we break down whether does it work? Is it effective? What does that look like? How come people are using it so much on the market? And let's dive into that a little bit. So Jen, you've actually tried this.
I have. So there's a company here that reached out to me a while ago and they saw what I did online and they were like, we would love to offer you this free time. Come sit on our Emsella chair, give it a whirl, see how you feel about it, and we'll go from there. So So I went, I did it. I sat for 30 minutes on this Emsella chair. The lady sat with me the whole time, which they don't normally, but she wanted to like chit chat with me, and that's cool. And it was a great experience that way. However, let me just tell you, you're sitting on this chair getting your freaking coochie zapped, okay? Like you just are.
Okay, but is it actually like you're actually feeling it?
Oh, I felt it.
Okay.
Absolutely. I could feel it just like flicking away down there. And I was like, I love that they say in their marketing that this is relaxing, because I feel 0% relaxed in this situation right now. Yeah, it wasn't a terrible feeling, but I was definitely like counting the minutes for it to be over.
Okay. Was it a constant zap or was it pulsing?
Constant.
Okay.
Like, tick, 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 tick. So,
okay.
Yeah, interesting. It was interesting, I'll say that. And then afterwards, they wanted me to kind of be like a rep for them and guide my clients into this Emsella path. And they would give me a free like 8-week session. Well, if you know how much these cost, you know that that is large, like $2,000 worth of product and services. And I was like, okay, let me think about it. And I went home and I looked at it more and I was like, this doesn't seem quite right to me. Like, knowing what I know about the pelvic floor and just what it actually takes to strengthen or decrease the tone and like get that baby moving and grooving happily, it didn't seem like that was quite gonna make the mark for me. And I didn't feel good about guiding my clients into that, especially given that with the tools that I'm offering, I'm giving them a better insight into their body in the first place. And I was like going back and forth in my head, well, how does this chair benefit them more than what they would learn about their body and how they would strengthen their body gradually over time and have that knowledge for the rest of your life versus this obviously something that isn't a long-term thing, because they did say to me that usually people come, they spend their 8 weeks here, they come a couple times a week, and then in 3 months we see them again and we do touch-ups. And I was like, so touch-ups forever, like at the tune of $2,000 or what? Like, what are we talking about here? And so that's where I started to like question the whole process.
Right. Okay. Yes. There's so much to unpack there.
Woof. Yeah.
Okay. So let's be clear here that the technology itself has validity. Like the research is showing some validity to this technology. Okay. So if we listen, I've spent not enough, but I've spent a few hours going through some of the research that I've been able to pull up, reading through some of these articles, and there is some validity to this product. The problem with it, there's some flaws in this research. The main thing being, and you kind of said it there, but the main thing being that we don't know how it is effective long term.
Yes.
Right? We know that exercise, breath work, learning about your body, all that knowledge and awareness that comes along with that is effective long term, because now you know how to do it and you can do it yourself.
Yes.
You don't need someone to hold your hand, help you do that for you, right? Once you've learned an exercise, you know how to do the exercise. Whereas when you're using a product like this, and it's not just this product specifically, but any product that you are relying on to do it for you, in theory, we're not going to have that long-term benefit, right? And that's one of the flaws in a lot of the research right now, is it doesn't look at the long-term benefits of this. It hasn't followed anyone past like 6 months to a year to see if they've had long-term relief, right? And that's one of the things that I'm seeing in some of my patients that have tried this out. Some of them have done a few treatments, some of them have seen improvement from it, but many of them have not seen that long-term gain. I've had, just over a handful of patients that have actually tried it, and I've only had one of them actually say that they've had long-term relief. Yeah. Now, I'll also add that they have been doing other things to help their pelvic floor too. They didn't just use this chair. So I would question whether it was the chair that actually helped them or whether it was the exercise and all the other stuff that they were implementing. Right?
It could be like that balance of all the things, like
Right.
homeostasis
Right.
coming into effect there?
Right.
Or is it the chair? I
Right.
have to question.
Right. And that's one thing that the research, we don't know yet, right? It hasn't been around long enough for us to figure that out. So there needs to be more research done in this area for sure. And most of the articles that I read, like they conclude with that, right? They often will say, you know, like more research needs to be done to see if this can be a long-term benefit. But that's the trouble here, right? And in my mind, the way I think and the way what I know about the body, just like you said, I can't see how this can provide a long-term benefit.
Right.
The one thing, or I guess we'll go into the other thing that is a flaw in the research, is that it doesn't compare it to any of this stuff. So so far in the research, what I found is it compares this HIFEM technology with respect to the Emsella chair specifically. I'm not talking about HIFEM in general. I'm talking about the Emsella chair. And it's important to separate those two, because HIFEM technology can be used on any muscle group. But I've looked mainly at the research around this Emsella chair that works through the clothing. And the research that I've come across only compares the Emsella chair to a sham, so basically a chair that you sit on that's not doing anything, so it's kind of like a placebo. And they also compare it to muscle stim, so NMES, neuromuscular electrical stimulation, which has been around for a very long time and is not supported by the research, the long-term research. We know that it can have some benefit on muscle strengthening, but we don't see the long-term benefits or the overall benefits of it. So they've compared it to that.
Is that the thing where if I'm at my pelvic floor PT, I'm like laying face down and she's like got this thing on my butt and it's like shucking me in the booty? Is that what that is? Just for everybody else.
It may be. It's hard to say exactly what that was, but yes.
It's a very vulnerable position I was in, let me tell you.
We're going to have to unpack that, because that is very awfully poor thing.
But it felt very similar to the Emsella, but just not as obviously not through my clothes.
Okay.
And I was not sitting on it. I was laying down. And it was a little bit more relaxing than the Emsella chair. Okay. Although I'm not selling it very well here.
Was it pulsing that you experienced from this one? Okay. So that does sound more like the muscle stim.
Okay. Yeah, I think that's what she did say, but it's been a little minute.
And that product we've used on, I've used it on athletes for rehabilitation, post-injury, post-surgery. If you've had that before, any kind of physio before, you may know it as like pads that they would put on, let's say your quadricep muscle, if you were getting rehabilitation there. They put pads there, and then it contracts the muscle, and you get this pulsing, tingly, and a lot of physios will actually ask you to contract the muscle while it's on, right? The research with that has shown that it can be somewhat effective if you're contracting while you're using it, but the research is not good if you're just letting it sit there, right? We know that there's no long-term benefits with that. So that's what they've compared this Emsella chair to, right? That's really the only thing they've compared it to, or a sham, a placebo.
Which is so interesting, because we know certain exercises are even more effective at this contraction than just a Kegel alone.
Right.
Like bridges.
Exactly.
It's 50% more effective.
So that's my question, is why have they not compared this chair to well-known effective treatment strategies for the pelvic floor? Like exercise, like stretching, like breath work, like relaxation techniques. All of these things we know can benefit the pelvic floor, and they're trying to say that this Emsella chair is better, so why aren't they comparing it? How can you say it's better if we haven't compared it? Well, and
if someone was going to make my food for me every day, I could withstand the Mediterranean diet.
Right.
But if I'm making food for myself every day, I'm going to eat those chips.
Right. Yeah. And this is where the novelty of this Emsella chair comes in, because people are looking at this and they're saying, oh, I can sit there on this seat that I won't feel anything, which is not true, as you've just heard.
It's not true.
And I don't have to do anything, and I'm going to achieve results. And if history repeats itself, we know that this is we know that this can't be true. So what I would definitely like to see is more research that looks at long-term results of this chair. Because if it can do that, let's see it. You know what I mean? I would love to see, like, can it really do that? Because I will be shocked if it does. Because a diet pill doesn't give you long-term weight loss.
No, you still have to learn the skills behind it.
Right.
And that's exactly what this is. You have to still learn the skills behind it if you want to maintain the results that it could potentially give you.
Right. Yeah. And so this is where there's a lot of gaps in the research. It's not showing us how it compares up to these other things. So it's hard to say if it's really effective, if it really works, when we don't really know.
Right.
Right? So this is where it's tricky, because I can't say like, nope, it doesn't work, like you shouldn't do it, because yes, there has been some research to show the benefits, and I've seen some patients improvement. However, it's been short-term improvement. We don't know what it does long-term. We don't know how it stacks up to other treatment strategies, like the effective ones that have been studied for years. And then the other thing in a lot of these research studies is I've found very few that look at strength outcomes. So a lot of it is muscle bulk, muscle tone, and reported outcomes improvements. And I found a couple research studies that looked at pad weights. So they would essentially have these women, they would measure how much leakage they had in a pad, and then they would do a couple treatments of the Emsella chair, and then they would have them wear another pad, and they would measure to see if there was a difference.
Interesting.
But the research does not show that that's a very valid tool, because there's other things that women discharge. It might not be urine that a woman is discharging, depending on where they are in their cycle, right?
There's a lot of variables. Exactly.
So it's very hard to look at that as a valid measurement tool, right? So it makes me question, is it actually improving muscle strength? And with respect to the Emsella chair, really, it's quality of life. Do you feel more confident? Are you having less leakage?
Yes.
Which is great. But if you're not getting actual muscle change to the point of strength, which I would love to see what the results of that are, then is it really effective? Right?
Dun, dun, dun.
So this is where I have a hard time standing behind this by itself.
Yes.
Because we just don't have the research to back it up yet, right? Now, I would argue that if you coupled this technology with all the other strategies that have been shown to be beneficial, then yes, there could be some success there. Right? So just like with muscle stim, research has shown that it's really only slightly effective if you're contracting the muscle while the stim is on, right? We know that. It makes me question, is HIFEM the same way?
Yeah, she did not tell me to contract. She just told me to sit. And to be really honest, this is going to get ugly for a second here. Because I know I know my pelvic floor as well as I do, I asked the question, how will this affect my high tension that I already hold in this area? And she was like, what do you mean? And I was like, excuse me, how are you talking to me about this? And you don't understand what I just said to you. That's such a common thing. And I bet you most women that go there, because we know through our experiences, most women have high tension somewhere in their pelvic floor, and that's causing this bladder leakage.
Right.
So if we're going to these people and they can't offer us that little insight, even just in something so simple, it makes me very leery. That was also a turning point for me, where I was like, shit, how does this affect my high tension already? Is it going to make it more tense?
Right. Yeah. And that hasn't been studied. We don't know. Right.
And that was a huge fear for me, knowing that I had come off of all of that, and I was like, I don't want to go back down that road.
Right. Yeah.
And I don't want to send anybody else down that road. Jeez Louise.
Yeah, and that's just it. I can't speak to that because I didn't come across that anywhere in the research that I read. I haven't tried the Emsella chair myself. And I haven't followed a patient while they were utilizing this. So that's an interesting point there, because we don't know what effect this would have, right? Because we do know that Kegels aren't enough. right? If Kegels were enough, pelvic floor physio wouldn't be a thing.
Right?
We
would not be here
having this exercise specialist, pelvic floor, like it wouldn't be a thing. But we know that Kegels are not enough. So if all you're doing is sitting on a machine that's doing the Kegels for you, then how can we say that that's enough? Right? Crazy.
OMG. A lot to unpack. I loved this conversation because, well, obviously I sat there and I had a lot of questions come up that were not answered fully in a way that I felt confident in, and that, red flag.
Yeah. I would definitely say if you're considering using the Emsella chair or trying it, like I said, the research is there to show that there's been some benefits to this, right?
Mm-hmm.
My encouragement to you would be, if you are going to try this, I think that's great. But I would definitely say talk to your physiotherapist, pelvic floor physiotherapist, before, during, and after, because they can definitely give you some strategies to go along with that.
Yes.
To help you be successful. And I think all of those tools wrapped together can be great. And I do think that they can provide benefits and success. And I think coupled together, it can be a really strong combination.
Yeah.
I'm just not convinced that this tool by itself can provide those long-term results that women need.
Yeah.
It's not just that they're looking for.
And I love that you said quality of life earlier.
Yeah.
Like, they want that quality of life.
Right.
So is it worth $2,000 to have quality of life for 3 months? Or is it worth your quality of life to have the skill set for the rest of your life?
Yeah, absolutely. So I think that it can be a great tool, but that's what it is. It's a tool.
Yeah.
It's not a treatment by itself from what the research is showing up to this date. There's nothing that looks at it long term, and there are still a lot of gaps in the research, and a lot of the research articles I read were performed by employees or companies that are associated with these companies that make the product. So it's hard to really say whether or not it's effective by itself. At this point, it doesn't look to be that way from my experience, but I definitely think more research needs to be done on this tool. I think it could be a great combination. Yeah, if you, like I said, we always say this, if you have questions, make sure you talk to someone, right? The internet can be a little bit misleading sometimes, and what people say, like you're going to get different results. Everybody's different.
Yes.
So it's important to get all the information, do all the reading, talk to the people that you trust, to the healthcare professionals that you work with, and make an informed decision, right?
Absolutely.
Because you deserve to know what's going on with your body. And it's important that you do, right? Yep. Knowledge is power. Awareness is key, guys. So,
huge. Yeah. All right. If you guys have any questions about this and you want to share them with us, shoot them our way. You know where to find us. It'll be in the show notes.
Yeah. Check us out, guys. Please, if you have any questions, we're here. Love you guys.
Love you.
Love you.